Hello, Huskies, and welcome to your Bloodborne Pathogens training. The objectives of this session are to train you to define bloodborne pathogens, identify workers who are at risk of exposure to bloodborne pathogens, identify key aspects of a bloodborne pathogens exposure control plan, describe methods for controlling exposure to bloodborne pathogens, and finally, describing steps to take when exposed to a bloodborne pathogen. Now that we have the objectives covered, let's define the term bloodborne pathogens. OSHA defines them as microorganisms present in human blood that can cause disease. The three most common pathogens found in the workplace are hepatitis B, hepatitis C, and HIV. We're now going to take time to discuss these in more detail. More than 1 million people nationwide are infected with hepatitis B. The virus can lead to chronic liver disease, liver cancer, and death. There are up to 100,000 new infections each year in the United States. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. Please remember that it can survive outside the body for at least 1 week within dried blood on surfaces. That's why it's important to properly clean and disinfect contaminated surfaces and tools. A vaccine has been available since 1982. Getting this vaccine is strongly recommended to protect you against this disease. This vaccine is strongly endorsed by the scientific and public health communities. It is safe when given to infants, children, and adults. There is no confirmed evidence that it causes chronic illness. Reports of unusual illness following vaccination are often related to other causes rather than to the vaccine. The vaccine is offered to all potentially exposed employees within 10 days of their initial assignment. The vaccine is provided at no cost to the employee. Finally, if you decline to be vaccinated, you will be asked to sign a form that states you have waived your opportunity to have the vaccination. However, you can change your mind. Let's look at information about hepatitis C. It is the most common chronic bloodborne infection. Like hepatitis B, it can lead to chronic liver disease, liver cancer, and death. Symptoms can take years to manifest, so persons who are chronically infected may not be aware of it. Chronic liver disease appears in about 70% of those who are infected. Symptoms include flu-like symptoms, jaundice, dark urine, fatigue, loss of appetite, nausea and vomiting, and finally abdominal pain. Treatment is improving with the advancement of antiviral drugs. Here are the facts that you should know about HIV. It is the virus that leads to AIDS. A person can carry HIV for many years and not have symptoms until it turns into AIDS. It attacks and depletes our immune system, which makes it difficult to fight off common diseases and infections. Early symptoms resemble the flu virus, such as fever, weakness, chills, and swollen lymph nodes. An antibody test is the only way for sure to know if you have HIV. It does not survive long outside the body. It is not spread by air, water, saliva, tears, sweat, shaking hands, closed mouth kissing, or toilet seats. Unfortunately, there is no cure yet for HIV or AIDS. There are other bloodborne diseases that occur less frequently. They are caused by viruses or bacteria. They circulate in blood for prolonged periods during at least some phases, and therefore are capable of being transmitted through blood or other potentially infectious materials. Most of these are rare in the United States. Listed here are some additional examples of potential diseases. Now that we understand what we can be exposed to, let's look at how these can be spread. There are two main sources how these diseases are transported. The first being blood and its components, and the second being OPIMs, which is other potentially infectious materials. Examples of these include human body fluids such as saliva, amniotic fluid, and cerebrospinal fluid. Since most of us at NIU are not healthcare professionals, we should consider all body fluids to be contaminated. We should also consider any unfixed tissue or organ, other than intact skin, from a human, either living or dead. The spread of bloodborne pathogens occurs primarily through direct contact, which is when infected blood or body fluid from one person is transferred directly to another person. Indirect contact, which is when a person touches an object that contains the blood or body fluid of an infected person. Respiratory transmission, which is when a person inhales respiratory droplets from an infected person, such as a cough or sneeze. And finally, vector-borne transmission. This is when a person's skin is penetrated by a bite or other means from an organism carrying the disease. Examples of this include mosquito and tick bites. In most situations, transmission is likely to occur because of punctures from contaminated needles, broken glass, other sharps, and also the contact between broken skin and infected body fluids. Anytime there is blood-to-blood contact with infected blood or body fluids, there is a potential for transmission. Unbroken skin forms a barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne, and any sort of damaged skin such as sunburn or blisters. Pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. Here are some examples of occupations that may be at risk. First responders providing medical care, building service workers, housekeeping and maintenance personnel, acute healthcare providers such as physicians and nurses, laboratory technicians, law enforcement personnel, and finally, medical waste treatment employees. The Centers for Disease Control estimates that 5.6 million workers are at risk for bloodborne pathogens exposure. OSHA regulates exposures to bloodborne pathogens and has developed a bloodborne pathogens exposure control standard. This standard requires employers to provide an exposure control plan specific to NIU, engineering and work practice controls to prevent exposure to infectious materials, personal protective equipment, and training in how to protect yourself against exposure. You can access the OSHA standard by the link provided or by contacting the Department of Environmental Health and Safety. An exposure control plan is designed to identify in writing tasks and procedures, as well as job classifications where occupational exposure to blood or other potentially infectious material occurs. It must also set forth the schedule for implementing other provisions of OSHA's bloodborne pathogen standard and specify the procedure for evaluating circumstances surrounding exposure incidents. An exposure control plan is meant to be a living document used as a source of information for answering bloodborne pathogen-related questions and to help ensure exposure control activities are in place. The ECP must include potential exposure determination, safe work practices, changes in technology that eliminate exposure, decontaminating equipment, selecting and using PPE, handling biohazard waste, labels and signs, training requirements, record-keeping requirements, and annual review and updates. NIU's exposure control plan is reviewed and updated annually. We keep our plan accessible. You can review it by the link provided from our website or by contacting the Department of Environmental Health and Safety. Inside our plan, you'll find the following topics: exposure determination, which identifies job classification and procedures that are at risk for occupational exposure to blood or OPIMs, schedule and method of implementation, which determines the methods of compliance by addressing research laboratories, hepatitis B vaccination, communication of hazards to employees, and record keeping. And finally, the procedure for evaluation of exposure incidents. Please take time to review our ECP and provide feedback to your supervisor regarding necessary changes. Now that we understand all of the measures in place that keep us safe, let's discuss how we can control our exposures. The most effective way to prevent the spread of infection is to perform hand washing following the World Health Organization's 5 moments of hand hygiene. They are: always before touching a patient, before any clean aseptic procedures, after any body fluid exposure risk, after touching a patient, and finally, after touching patient surroundings. To enhance this practice, waterless hand sanitizers have been placed in various accessible locations across campus and may be used for hand hygiene, unless your hands are visibly soiled. Another way for employees to prevent exposure is to observe universal precautions to prevent contact with blood or OPIMs. All body fluids shall be considered potentially infectious materials. Treat all infectious materials with appropriate precautions such as use gloves, masks, and gowns if blood or OPIM exposure is anticipated. And finally, use engineering and work practice controls to limit exposure. As mentioned previously, we can prevent exposure through engineering and workplace controls. It is important that we evaluate available engineering controls or safer medical devices, review new devices and technologies annually, implement appropriate engineering controls and devices, train employees on safe use and disposal, and finally, document evaluation and implementation in the ECP. The next step in controlling exposure is the use of personal protective equipment. General PPE guidelines include: wear gloves when handling chemicals and/or body fluids, wear safety shoes, boots, and covers if hazardous substance is likely to splash, wear an apron, gown, and/or coveralls if hazardous substance is likely to splash, use a respirator when hazardous substance is airborne, such as tuberculosis, wear hearing protection for loud noises, remove PPE carefully to avoid contaminating yourself, dispose of PPE in designated containers before leaving an area. To ensure the greatest possible protection for employees in the workplace, the cooperative efforts of both employers and employees will help in establishing and maintaining a safe and healthful work environment. In general, employers are responsible for performing a hazard assessment of the workplace to identify and control physical and health hazards, identifying and providing appropriate PPE, training employees in the use and care of the PPE, maintaining and/or replacing worn or damaged PPE, finally, reviewing, updating, and evaluating the effectiveness of the PPE program. Providing appropriate PPE and training is critical. The training curriculum should include these topics: when do we need it? What kind is necessary? How to properly put it on, adjust if needed, wear during work operations, and take it off properly, the limitations of the equipment, and the proper care, maintenance, longevity, and disposal of the equipment. Now that we have finished the employer's responsibilities, let's discuss what employees need to do. In general, employees are responsible for properly wearing of PPE, attend your training sessions, care for, clean, and maintain your PPE, and inform a supervisor of the need to repair or replace your PPE. Here are some safety guidelines during routine housekeeping. It's important to keep a written schedule for cleaning and decontamination of your work area. All equipment and surfaces should be cleaned and decontaminated after contact with bloodborne pathogens. Equipment grossly contaminated must be cleaned with a soap and water solution prior to decontamination. Protective coverings on equipment shall be removed and replaced as soon as possible when they have become overly contaminated or at the end of your work shift. All bins, pails, cans, and similar receptacles intended for reuse, which have a reasonable likelihood for becoming contaminated with blood or other potentially infectious material, shall be inspected and decontaminated on a regular scheduled basis. Broken glassware, which may be contaminated, must not be picked up directly with your hands. Using mechanical means, such as a brush, a dustpan, tongs, or forceps. Your job responsibilities may include the cleaning and disinfecting of surfaces that have been contaminated with blood or OPIMs. OSHA currently accepts the EPA's registered disinfectants for HIV and HBV and deems them appropriate disinfectants to clean contaminated surfaces. While cleaning and disinfecting, follow these instructions. Wear appropriate PPE while performing the task. Know that all blood must be cleaned thoroughly before applying the disinfectant. Properly dispose of the infectious waste in accordance with federal, state, and local regulations. That the surface is left wet with disinfectant for 30 seconds for HIV and 10 minutes for HBV. And don't forget to wash your hands when finished. The term regulated waste refers to the following categories of waste, which require special handling: liquid or semi-liquid blood or OPIMs, items contained with bloodborne pathogens and which would release these substances in a liquid or semi-liquid state if compressed, items that are caked with dried blood or OPIMs and are capable of releasing these materials during handling, contaminated sharps, and pathological or microbiological waste containing blood or OPIMs. It is the employer's responsibility to determine the existence of regulated waste. This determination is not based on actual volume of blood, but rather on the potential to release blood, an example being when compacted in a waste container. Regulated waste shall be placed in containers which are closable, constructed to contain all contents and prevent leakage of fluids during handling, storage, transport, or shipping. They should be labeled or color-coded. And finally, closed before removal to prevent spillage or protrusion of contents during handling, storage, transport, or shipping. Let's discuss the labeling of all regulated waste containers. Labels communicate the hazard to persons who will handle the containers. Place regulated waste in containers that have the universal biohazard symbol on them, as shown here. The term biohazard must also be written on the label. Labels with the symbol and the word biohazard meet EPA requirements for labeling regulated medical waste. Disposal of unregulated biohazard waste has fewer restrictions than regulated waste. Here are some guidelines for identifying and disposing of unregulated waste. Blood or OPIM that is absorbed without the release of liquid when compressed is unregulated waste. Generally, adhesive bandages such as Band-Aids or paper tissues that we would typically throw in the wastebasket are not regulated waste. Gauze, paper towels, and disposable PPE might result from the cleanup of a small injury, such as a cut. If the blood or fluids are completely absorbed, this is not a regulated waste. To prevent creating regulated waste, absorb all liquids so that no liquids will be released if the absorbent material is compressed. Absorbent powders worked well because it turns the fluid into a gel-like substance. Unregulated waste does not require labeling, but is a good practice to do so. All employees with occupational exposure must receive initial and annual training. In addition, training must be provided when changes to tasks or procedures affect a worker's exposure potential. The training will be of no cost to the employee and will be held during normal working hours. This training program has covered the required curriculum that the OSHA standard for bloodborne pathogen mandates. You can view curriculum requirements in the NIU ECP. OSHA also requires that the instructor conducting the training is required to be knowledgeable in the subject matter covered by the elements in the training program and be familiar with how the course topics apply to the workplace that the training will address. The trainer must demonstrate expertise in the area of occupational hazards of bloodborne pathogens. The instructor must be available to answer questions that may arise during a training session. Let's define what an exposure incident is. It is a specific eye, mouth, mucous membrane, or non-intact skin contact with blood or OPIM that results from the performance of an employee's duties. If you are exposed to blood or OPIMs, wash needle sticks and cuts with soap and water, flush splashes to the nose, mouth, or skin with water, irrigate eyes with clean water or saline. Remember, there is no scientific evidence showing that using antiseptics or squeezing the wound will reduce the risk of transmission of a bloodborne pathogen. Using a caustic agent such as bleach is not recommended. Notify your supervisor immediately. Prompt reporting is essential because in some cases, post-exposure treatment may be recommended and it should be started as soon as possible. The supervisor will immediately refer the potentially exposed individual to the appropriate healthcare professionals for post-exposure and evaluation. The post-exposure medical evaluation is intended to help determine if you were exposed to infected blood or body fluids. It is a completely confidential evaluation both for the exposed person and for the source person. Not even NIU will know the results of the testing. The evaluation will document the route of exposure. It will also identify the source individual. The evaluation will include testing the source person's blood if he or she gives consent. The following are key points to remember about this training session. Bloodborne pathogens can cause fatal disease. Be aware of the potential for exposure to bloodborne pathogens at work. Exposure can happen if a coworker suffers a bleeding injury or when you are administering first aid, touching a contaminated surface, cleaning up blood, cleaning a restroom, touching a tool that has dried blood on it. Take universal precautions by assuming that all blood or body fluid are infected. Use PPE as a barrier between you and the source of infection and follow safe work practices such as labeling and proper disposal of infectious material. Decontaminate yourself by thoroughly washing up after potential exposure and decontaminate any tool or equipment that might be exposed. Understand and follow exposure incident procedures if you think you might have been exposed. And finally, report any incident of possible exposure to blood or body fluids so that they can be evaluated and appropriate steps can be taken if necessary. Thank you for your time, and we hope you feel confident with bloodborne pathogens training. If you have additional questions or are looking for further information, please feel free to contact the Department of Environmental Health and Safety or visit our website.